you don't tickle her head in the right spot, she lets you know.
At the Bondi Clinic, a new patient has arrived for Chris, a pet cockatiel called Cheeky.
We go almost everywhere together. Shower, shops, bike riding, car, bank. Yep.
Do you both want to come through? Who do I ask, Cheeky or you, Brenna?
Both.
Both, okay.
I've noticed some drops of blood today on the bathroom floor, so
Okay.
she is bleeding, not from her feet, I think from her genitals, so I was really quite worried about that.
Oh.
You sort of just have to tell her, not ask her. That's
Oh, really?
Yeah.
Got to be firm.
Yeah.
She's a strong woman.
She is. So if you just tell her what you want to do, she'll do it.
She likes assertive men.
She does.
It's always been a problem. Come on. Now, Cheeky, no. Yeah, you're going to get up there. Thank you. That's the way you go. It's how you treat a woman. So I guess a few drops of blood doesn't sound like much, but in a bird, that's...
Quite a bit.
Yeah, quite a bit. Okay. So I just want to have a good look at her. There is a little bit of blood around here. What's this going on?
Oh my God, what is that?
Chris has found the source of Cheeky's dangerous bleeding.
At the base of that gap is a hole.
Yes.
And that's where that blood's coming from.
Yes.
So I think she's actually lost a feather.
Sweet lamb.
What we'll do is just clean it up with some antiseptic and just try and clean around the base of where that feather's come out. So I guess we need to work out how she's done this, because the worry is that if she does this when you're not around or when you're asleep and she actually has a decent bleed, she can actually get into quite serious trouble. So has she been doing anything abnormal behaviour-wise?
She...
What Prem's struggling to say is that the naughty Cheeky spends too much time self-pleasuring.
How often?
She does it every day.
Yeah. For how long?
Sometimes a lot every day. Sometimes for 15 minutes.
15 minutes.
Yeah.
Cheeky is so incredibly sexually frustrated, so wound up, that not only is she pleasuring herself, she's gone to the next step. She's pulling her own feathers out. What does she do it against?
There's a part of the twig that she always kind of backs up against. Mm-hmm. She stands on one leg to get like right in the right position. It's really funny. She'll like lower herself right down on one leg.
I think that comes under the title of a little bit too much information. Cheeky, get on the hand.
That's it.
So what is the solution to stop Cheeky's harmful habit?
She's doing that right now because the weather's just warmed up.
Yeah.
And because of that, she has all this energy, but also all these messages in her body saying, you must mate, you must breed. But there's nothing around her that she can mate with.
Yeah.
So what she needs to do to lower that sexual frustration is to convince Cheeky that it's actually not springtime. And the way you do that is actually lessen the daylight hours. Put Cheeky to bed in a darkened room at 5 o'clock in the afternoon. So Cheeky, sounds like you're gonna get the treatment you deserve. Early to bed like all bad girls. There you go. Hey, Cheeky.
Felix.
Meanwhile, at Bondi's referral hospital Sash, a 5-month-old Burmese kitten has just been admitted with a mystery illness.
Well, Felix was absolutely fine until yesterday, and this morning he didn't eat his breakfast, and he was really down, and he's usually a lively little kitten, and his skin was all dry, and then he started retching and vomiting and diarrhoea and just being really floppy.
He's reacting when I'm touching his kidneys. Felix is in a lot of pain. Cats are normally really stoic animals, and he's yelping out when I'm feeling his abdomen, so he's in a lot of pain over there.
Have you eaten something not nice?
It's possible that he could have swallowed something. He's a young cat, and kittens play with things, so...
Indoor, outdoor?
Yeah, they ingest lots of different things, and it's very possible. I can't feel anything obvious there, so he's a very sick little kitten. Yeah.
Felix is your friend, isn't he? You're a bit sad as well.
Let's just hope it's something that we can fix. Let's get some blood off him to try and give us an idea of what's going on.
5-month-old Felix has been rushed into Sash with severe abdominal pain and a high fever. Lisa is running tests to work out why.
He's a pretty sick little kitten. He's got a temperature of 41.3, which is quite high. He's definitely got abdominal pain, like you mentioned before. He's groaning when I'm pressing. I wonder if it's his kidneys that are sore. It's really hard to say because there's so many organs in there. We need to try and work out what's going on, because to have that amount of pain, there's got to be something nasty going on in there.
Good boy, good boy.
With the signs that Felix is showing, I guess I'm concerned about an infection of the kidneys, pancreatitis, and another disease which is called FIP, feline infectious peritonitis. Oh no, you're not going to put up with us for much longer. If he's got FIP, it's really bad news. It's a fatal disease and there's nothing we can do for them. And it's just not something that I want to go and tell his owners. You want to give your mum and dad a cuddle? Felix is a much-loved little kitten. He's their baby and they're really worried about him. Hopefully I'll have some more answers for them by the end of the day.
I'll call you later, yeah?
Over at SASH, Felix's blood results are in and the news is not good.
He's got a white cell count of 35, the upper end of normal's 19.5, so that's a pretty significant elevation.
A high white cell count indicates inflammation of the organs. This means it could be FIP, a disease that attacks the entire abdominal area.
FIP is a fatal disease and there's nothing we can do for them, so I'm a little bit scared that that's what he's got, and I'm hoping that's not the news I'll have to break to his owners.
Felix will need an ultrasound to clarify the diagnosis.
All right, little Felix. Hey, puppy. You're all right. You're all right.
Hot little belly.
At the Bondi Referral Hospital SASH, Lisa's about to find out the fate of young Felix.
In this ultrasound, we're looking for signs of inflammation, any free fluid, enlarged lymph nodes, abnormalities in any of the organs. We're also going to have a look at the pancreas and the kidneys to make sure that they're not inflamed.
Vet Darren Foster is hoping only one organ is affected, which would rule out FIP.
So the fact that you're seeing it like that is very significant.
Yeah, and that's where he's most painful as well.
Oh, I really hope it's not FIP. Worst case scenario for Felix would be that he has feline infectious peritonitis, which is a really nasty disease. It's a terminal disease and they can have days to months to survive.
The kidney and bladder are given the all clear. Now Darren checks the pancreas.
Just down here, he's got this black spot through here, and all the fat around here is quite inflamed, and that black spot I think is his pancreas.
Oh, pancreas.
Yeah. So I think actually he might have pancreatitis.
Well, that would be best case
The
scenario.
best case scenario for little Felix.
The pancreas is a gland that produces enzymes which help digest food. When inflamed, it's very painful.
Probably from bacteria that get in up from their bowel and infect their pancreas, or just from sudden dietary changes, dietary indiscretions, eating mice.
Are you happy?
That's great.
You really happy?
Yeah.
Okay, good. If you're happy, I'm happy.
The treatment for pancreatitis is lots of fluids, antibiotics and pain relief.
All right, little Felix, I think this is your lucky day. Huh? Let's get you back in your cage. I know. Come on. Hey? Sick of being in a cage.
At SASH, Felix's treatment for acute pancreatitis is already working.
Felix. Felix is doing really well. His temperature's come down to almost normal, still slightly up, but he's definitely feeling a lot more comfortable in his belly. You're a monkey. What? You want to go home? You want to go home?
Oh, it's Felix.
It's your baby.
There you go.
Oh, it's just fantastic news. I can't believe he's so well after less than 24 hours. It's amazing. After yesterday, I thought it was pretty grim. Didn't think he was going to make it. Good boy, hey? He's worried not sick. Lovely to have you back, hey, mate?
Yeah.
Oh. Who's going to give him a kiss?
Mariki?
Mariki, what about the kiss of the cat?
Kiss for the cat. Good boy. Hey.
boy.